So what is your suggestion for the best approach to help the autistic kids and the family?
To have an early diagnosis is important, and then to get to a good therapist or a center that offers behavioral analysis, applied behavior analysis, or a different form of therapy is probably the most important thing for the child to develop. Beyond that, as the child matures, we know that there are various drugs that are recommended or can be applied, to reduce the anxiety.
That's right.
Anti-anxiety drugs. There's also, sometimes, particularly the boys are very aggressive, so the aggression can be something that's a big problem for the family. And in fact, there are several drugs, risperidone, and that's been approved by the FDA. And at our institute, IBR, we have two doctors, Dr. London and Dr. Yu, that have been studying the use of propranolol, which is a beta blocker drug. Dr. London has an autistic child, and it's worked quite well with him for the behavioral problems, the aggression that they show. And they've recently gotten a very large government grant to do a controlled study of propranolol in treatment of.
In which aspect that can improve the
the behavioral problems that are aggression, aggressive behaviors, hitting the mother.
Okay, that can help to control that aspect.
Or extreme anger, outbursts of anger. Because propranolol is a beta blocker; it blocks adrenaline, and so
can decrease the energy and decrease. So, but it's supposed to still, before 6 years old, the kids are not recommended to use the drugs, right?
That's right. In general, probably not. So more the applied behavior analysis approach, or the Denver model of floor time, or these are various.
That's right.
Encouraging the child to communicate, to play with the caregiver, with the mother, or with other children, and that's kind of the most important thing, is to encourage the socialization.
Yes. 60%到70%还是觉得是有遗传因素占了60%到80%的，很重，就是比环境的影响，因为环境比方说母体有那个病毒感染啦，有那个可能接触了一些有毒的化学物质啊等等，也都比如说高龄啊都有影响，但是遗传还是更重要的影响。The host has a question to you to avoid, to the risk of, have the autistic child. So when the couple get married and prepare to have a child, what do they should know or prepare to, try to avoid the risk of having?
Well, we know that, diet, good nutrition of the mother is important. And then it's possible to have, early in the pregnancy, or even before pregnancy, to have genetic screening. For Fragile X can be just a blood test. And then if the mother's a carrier, we know then they can be monitored in the pregnancy or decide what to do. And there are a host of other conditions. Whole genome screening is becoming recommended, where you look for any gene that can be identified.
But that can be very expensive.
The cost is actually dropping dramatically.
Oh, really?
Yeah.
With AI, probably even in the future will be much easier.
The cost of it's now about $1,000 for whole, and that's it used to be the cost of one test many times. So, and then with AI, it's going to drop to $100 within a few years.
Another question is the test that you mentioned is already sort of a widespread, worldwide, and people can use it, or just some specific laboratory.
Well, I was in Australia for some years, and before, I was there for 6 years. And the Australian government passed a law that anyone who's planning to have a child can have this genetic screening. And they did a pilot study of 10,000 couples, and they did whole exome sequencing, which is not quite whole genome sequencing, but it's along the ways, and that's available now. Whole exome sequencing and look at hundreds of genes to see
related to the autism, that's risky genes,
or any
Fragile X,
or other serious conditions that they should know about beforehand. Again, the risk of having a genetic problem is relatively small, maybe 3% for any pregnancy, but it's still, if you can do something about it or prevent it, then you should know about it. And this is what's coming. And so the Australian government now provides that free of charge, or part of the national healthcare system. To do,
I think China probably also.
It's becoming common, but it was sort of a trial program to see how many of the couples they would screen had one of the three most common conditions, which are Fragile X, cystic fibrosis, and spinal muscular atrophy. But what they found was that 80% of the diagnoses that they made were other conditions that were rare, much rarer. Only 20% of the 10,000. Of that, they had about 150 positive diagnoses of the 10,000 that they screened for, maybe 300. I forget.
That's still very rare.
But it was, even rare diseases they can pick up and alert the couple to know that they're at risk for recessive conditions and or Fragile X or cystic fibrosis, spinal muscular atrophy, which are the three most common. Spinal muscular atrophy now has a genetic treatment. And it can be given to the child at birth, and then they grow up normally. Otherwise, it's quite a severe, devastating disease.
They can end up just paralyzed.